Insulin resistance and pancreatic beta cell dysfunction are the two main pathological features of type 2 diabetes. When our bodies develop insulin resistance, cells fail to respond properly to insulin, and over time, the pancreatic beta cells that produce insulin can lose their function. But could proteins offer a solution to these problems? Certain proteins play crucial roles in regulating insulin sensitivity and beta cell function. For insulin resistance, therapeutic proteins like adiponectin can enhance insulin signaling pathways. This protein, naturally produced by fat cells, improves glucose uptake in muscle and reduces glucose production in the liver, effectively combating insulin resistance at its core. Another promising approach involves using engineered antibodies that target and block proteins that contribute to insulin resistance. For example, antibodies against the protein TNF-alpha can reduce inflammation, which is closely linked to insulin resistance in tissues. For restoring beta cell function, growth factors such as GLP-1 and Exendin-4 are protein-based treatments already in clinical use. These proteins stimulate beta cell proliferation and protect existing cells from stress-induced death. They work by activating specific receptors on beta cells, triggering regenerative pathways. Stem cell-derived proteins also show potential for beta cell regeneration. These bioactive proteins can create an environment that promotes the survival and function of remaining beta cells, while potentially stimulating the formation of new ones. Protein delivery methods have evolved significantly. Newer approaches include encapsulated protein delivery systems that protect therapeutic proteins from degradation and target them specifically to pancreatic tissue or insulin-resistant organs. Gene therapy represents another frontier, where genes encoding therapeutic proteins are delivered directly to tissues, allowing for sustained local production of these beneficial proteins. This approach could provide long-term treatment with fewer side effects. The future of protein-based therapies for diabetes looks promising. Combination approaches that simultaneously address insulin resistance and beta cell dysfunction may offer more comprehensive treatment. Personalized protein therapies, tailored to an individual's specific metabolic profile, could maximize effectiveness while minimizing side effects. As research continues, protein-based treatments may eventually shift diabetes care from managing symptoms to actually reversing the underlying disease processes, potentially offering a functional cure for millions affected by this condition worldwide.